Hi, my name is Tabora-Mantilla, and I will be demonstrating how to treat injuries through different parts of the body. This includes treatment for a laceration in the head, a laceration in someone's limb, a laceration with borders on someone's limb, and a sprain of ankle and wrist. I will also perform how to do an anatomical splint, a rigid splint, a soft splint, and an improvised sling. As a first aid responder, we must always cover the 3 C's. Check to see if the environment is safe to care for the patient, call 911 depending on how serious the injury is, and finally take care of the person. In the following clip, I will be performing a laceration treatment on the arm due to an injury caused by the person climbing down a tree house where she cut her arm with the sharp end of the tree in the stem. For this injury, I will use gauze to apply pressure to the wound. I have asked her to apply pressure temporarily as I begin to wrap around her arm with gauze. Wrapping it around with gauze helps us secure in place. Finally, I will cut the piece and add medical tape, that way the gauze does not fall. I will also lift up her arm above her heart. In the following clip, I will be performing how to treat a laceration of severe bleeding in the head due to the injury caused by the person sleeping in her bed as she accidentally fell over and fell to the floor. For this injury, I will use a trauma pad to apply pressure on the wound and using a bandage wrap to wrap it in place around her head while asking how they're feeling, if they're feeling okay or dizzy. In any injury treatment, we must always create a physical barrier between ourselves and any possible fluids that may come from the victim's body. At this moment, the person felt dizzy, so I put a pillow under their head as they laid. I elevated her feet with another pillow on the other end and used a blanket to keep her warm. Remember, they cannot be too warm or too cold. In the following clip, I will perform a laceration with borders due to the injury that was caused by the person breaking a vase and cutting themselves as they were picking up the glass pieces. Lacerations are to be treated immediately because they can become serious if the cut is more than 1 inch long and 1/4 of an inch deep. For this injury, I will be first cleaning the wound with a medical antibacterial wipe. I will be using butterfly tapes to improvise stitches since this laceration needs to be treated right away. I will only use one since the cut did not result too deep. In the following clip, I will be performing a sprained wrist treatment, which is the same for a sprained ankle, due to the injury caused by the person doing gymnastics and landing wrong as she did a back handspring, thus causing a sprained wrist. For this injury, I will treat it by quickly immobilizing it by wrapping an elastic bandage wrap around the wrist and giving her a heat pad to place on the wound twice a day for 5 to 7 days to reduce risk of swelling along with elevation. A sprain is usually a tearing of the ligaments at the joints. It can be mild, which produces just swelling and a quick recovery. It can be severe, which is a tearing of the ligament and can also involve or be a part of a fracture and can often occur in an ankle, wrist, or knee. For the anatomical splint, I will be using the uninjured leg to help support the injured one. With this splint, you are supposed to use triangular bandages, but however, I did not have any on hand, so I will improvise with using strips of gauze. I have already placed the gauze strips under the person's legs and continue to tie each of them so the supporting of the uninjured leg to injured leg can begin for proper treatment. Prior to any splitting of an injury, you must always get consent and check circulation before and after treating the patient. For the soft splint, you will need a soft piece of material like a cloth or towel and placing it underneath the injured limb. Make sure it can cover both the top and bottom part of injury. Once again, the technique requires triangular bandages. However, I do not have any at reach, so I will improvise using strips of gauze to wrap it around the cloth to have it stay in position. Make sure to not wrap too tightly. After splint has been placed, I will recheck circulation once again. For the rigid splint, I will use a wooden stick, but I will wrap it with gauze so it feels more comfortable on the arm of the patient. For this technique, it is required a triangular bandage, but I do not have any, so I will continue with the use of gauze. After it has been wrapped, I will place the wrapped stick on the bottom part of the arm and create knots to secure the stick in place with the gauze strips. I will then use a wrap to wrap around the person's torso, including the arms on the side, so I can provide support to the injury. After splint has been placed, I will recheck circulation once again. For the sling that will be shown in the following clip, I will be using the same demonstration as I did for the rigid splint due to the fact that I do not have any triangular bandages, so I will improvise using elastic bandages as shown. I will place the arm under the wrap and move the left side of the wrap under the elbow to create a sling figure and provide support.